Hello, today I wanted to talk to you about diastasis recti or abdominal separation. And I just wanted to give you a bit more information about what it is. And for me, diastasis isn't just about that rectus abdominis. It's not about just that midline. It's a dysfunction of the entire abdominal wall. It's a dysfunction of the capacity of the tissues and also the tension and the integrity to transfer load and withstand intra-abdominal pressure through that midline. So the ab wall, if you have abdominal separation, again, I can test this, but during pregnancy, that last month of pregnancy, your tummy muscles have to separate because they're growing a baby. And then afterwards, your abdominal muscles have stretched and the abdominal wall will have lost its tension and its integrity. And we have to look at the optimal synergy between the soft tissue and the bony structures that allow you to transfer load and deal and manage with intra-abdominal pressure in the safest way possible. As a new mum, you're lifting, you're carrying, you're twisting, and we need to make sure that you're doing that in the safest way possible that can withstand that intra-abdominal pressure that goes through your body. And so for some women, this just doesn't happen. And if that integrity is lost completely, then sometimes clinical intervention is needed, and this means surgery. But again, I can test your functionality, I can test your gap, I can test that tissue to give you a professional view on what I think is going on in your midline. So when I screen someone, when they come to me and they say that they're not happy with their tummy or they're getting back pain, I have to screen them thoroughly. And this includes back pain, it includes issue with pelvic floor, incontinence, prolapses. This is just one unit which we need to work optimally, and in order for it to function properly, there are so many other players in the game and they all need to be doing their job. And sometimes some of them are doing their job too well and they're too tight and your body's using them to stabilize you instead of your core muscles. So it's about trying to juggle that act between getting you functioning and maybe down training a few other muscles like the piriformis or the internal and external obliques that can be quite grippy in that postnatal phase because they're overcompensating for stability in areas like the core and the pelvic floor, which aren't doing their job properly. So I hope that kind of gives you a little bit more information about what I'm doing when I'm checking your tummy, when I get you in for an assessment. And also we need to be thinking about skin stretching. We need to think about muscle stretching. We need to think about tendon stretching. So tendons take a lot longer than muscles to heal. And fascia stretching, the whole area. We need to really be thinking and taking a holistic approach to your restorative time. And it's not just about strength, strength, strength. It's not just about building that muscle up. It's also about releasing and relaxing and self-care and giving you this whole holistic approach to your rehabilitation phase. And yes, mums, you need this time. You need this restorative post-birth rehabilitation. I can't tell you how important it is. And if you didn't even do it postnatal and now you're maybe 2, 3, 5, 10 years down the line and you're still having some issues, never give up. This programs and courses can help you no matter how far along in your childbirth years you are. So never ever give up. So key points for me that I want to get over in this presentation is that diastasis, we have to take a whole body and lifestyle approach. We can't just think about the tummy. We have to look at posture, nutrition, breathing strategies, how you poop, hydration, hormonal balance, stress management. All these are vital in your restorative program, and it has to be holistic. The distance between your rectus abdominis is only part of what I'm looking at. It's about the integrity of the whole global core. So this is your transverse, your linear alba, your rectus abdominis, your internal external obliques, your diaphragm, your back, your pelvic floor. All of this has to be taken into consideration. Never judge a book by its cover. So what I mean by that is that I could look at someone and think, oh yeah, you know, they're slim, they haven't got abdominal separation, but actually they could still have abdominal separation and their core might not be working. Or you can be a bigger lady and I test your tummy and you've got no abdominal separation. So don't just look at somebody and think that they're okay. Or just because you've lost all your baby weight, you think you're okay. It's always necessary to do this rehab. And again, we need to get your pelvic floor, your abdominal work, your breath, all working in synergy together. And that's a huge driver to get you stronger and more connected. So I hope this has helped you to understand a bit more about abdominal separation, how I can help. And I have courses and programs. I do one-to-one, I do small groups, I do mum and baby. And it's all about this, getting you reconnected to your core and your pelvic floor, your breath, giving you time. This is all about you. It's not about your baby, it's not about your kids, it's not about your husband, it's all about you. And giving you this time that you deserve and that you need and that you deserve as a mum. You know, we need to take the time for ourselves. So I hope this has helped to give you a little bit more information. And if you've got any questions at all, please just let me know.